Battered baby syndrome. Battered baby syndrome, also known as the battered child syndrome, Cafe Kimber syndrome, maltreatment syndrome, non-accident injury of childhood, parent-infant traumatic stress disorders. Trody's syndrome is a clinical condition in which young children, usually under 3 years of age, are beaten repeatedly over the most trivial provocation. Children are often unwanted, male, mentally deficient, disabled, and step children. Silent features lack of provocation. Beating is completely excusable. Provocation is always trivial. Predisposing precipitating factor. Often child is irritating action, example crying, refusal to be quiet, persistent soil of napkin, deprivation of nutrition, care and affection is present. Delay. There is often delay between onset of injury and medical attention sought. It is sought only when the child becomes critical and patient. Parents lose nerve. The explanation is lack of money. Cerebral palsy. 10 to 15% cases of cerebral palsy may be the results of the battered baby syndrome. But baby syndrome was first described by Tardieu in 1860 but remained largely unknown in 1946. American pediatrician John Caffey described it again. The syndrome became commonly among known after that. Epidemiological factors usually less than 3 years, but can occur at any age. Males are mostly affected. Status of a child in family, unwanted, disabled, step of children, failure of contraception, pregnancy before pregnancy, marriage, pregnancy before marriage, socio-economic factors, age, parents, age and 20 to 30. Family isolated, guilt, amnesia, have criminal record, less education, less IQ, socio-economic class, low psychiatric problem, socially unstable, unemployed patient, parents themselves brought up in disharmonious families having long-standing emotional and financial problems, poverty, violent family, there were themselves battered by children, wife often battered by husband by with battering continuing during pregnancy, unhappy childhood experience, history incompatible with injury. Repeated trauma over the time is the hallmark of BBS. This causes abrasion, bruises, burns, fracture, and other injuries of different age. The classical explanation offered by parent is that child fell often down the stairs. If that were the case, the age of all injuries would be the same. Parents change history as they go to different doctors, even with the same doctor. That history may have serious contradiction. Injuries are due to direct common violence, commonest external injury, tear of the front limb. It is the commonest typical injury. Laceration of the mucus or upper lip is also seen. Laceration may also large to cause separation of inner surface of lips from base of gum. Typically caused by efforts to silence a screaming blow on the face, may also produce by trying to suffocate child. Soft tissue injury, type, site and shape almost anywhere in the body. Abrasion on back caused by dragging, bite mark on cheek, neck back. Bruises or on either side of the chest, behind the axilla, down the anterior chest wall and around the large joints, example elbow and joint, indicate places where child was gripped strongly. Sixpenny bruises on buttocks and thigh caused by belt, canes and so common household object, wooden ladles, hair brushes, a piece of wood, strap, etc. 27.6. Case of battered babies, multiple injuries on legs and back or different produced by different manners. Rod on the ear, dragging mark on back. Was bullet, gray separation on back indicating dragging. Knuckle branches on the back shows a rows of 3 to 4 rod bruises represent metacarpal of the offending fist. Laceration beating by hard blunt object, canes and sticks. Pinch mark often on face, neck, back, buttock, thigh appear as a butterfly shaped bruises with one wing caused by thumb larger than the other, caused by opposing finger. Slap mark shows a clear bruise or lines of pedicle hemorrhage resembling fingers of the slap on cheeks and neck, back. Scalp injury is very characteristic, caused by vigorous pulling of scalp hair. Subgaleal hematoma, traumatic alopecia, bald patches on scalp, cause of handling, beating, kicking or throwing in the infant around the age. Typically, the injuries of different ages as they are inflicted at different point in time. Eyes, black eye, retinal hemorrhage, subconjunctival hemorrhage, subhyaloid hemorrhage, vitreous hemorrhage, lens displacement, retinal separation. Internal injuries. External injuries may be present with minimal or external injury with no external signs of injury. First, skeletal injury, lesion due to direct beating, skull fractures, especially in occipito-parietal area. They are depressed, multiple and wide, transverse and spiral fractures of long bone, especially due to twisting of arms and legs. Traction lesion of the periosteum of long bone without fracture, periosteal hematoma if fresh, Periostomy is bulging with blood seen. If older, seen radiologically as an extra line of opacity running along the affected length of the bone due to calcification of bleeding which occurred under the periosteum. Periosteal shearing, because periosteum is easily stripped off in infant. Periosteum is easily stripped off in infant. Epiphyseal separations in radiologically as small fragments separated from the main bone. Avulsion of metaphysis or a chipping of the edges of the metaphysis. Anterior posterior compression of the chest. Fracture of ribs in mid-axillary line. Side to side compression of chest. Fracture at the postcochondral junction. A fracture along the posterior angles of ribs after 1 to 2 weeks. A callus formation. On X-ray, there are seen as strings of beads in the paravertebral gutter, knobbing fracture. Second visceral injury, brain and hemorrhages. Subdural hemorrhage found in about 40% of cases. Lungs, a post-traumatic pulmonary pseudocyst. Liver bursting injury, another name for laceration, crushing on a crushing force on abdomen or by fist. Spleen, a bursting injury is caused same as the liver. Hollow viscera, stomach, intestine and urinary bladder may be ruptured, especially if compressing force, fist, etc. was applied and the viscera were distended. Second part of duodenum and jejunum were completely transected. Tearing of the mesentery may cause complete disruption in the small intestine. Diagnosis in the living can be done by time taken to seek medical advice, nature of injury, recurrence of injury, imaging study, X-rays, MRI Technetium 99, methylene diphosphonate, MDP, bone scintigraphy, fluorine 18 labeled of sodium fluoride, positron emission tomography. In the dead, imaging study in the living before autopsy dictated old fracture, epiphyseal and metaphyseal injuries in various stages of healing. Autopsy shows extent and internal injury as mentioned above. Cause of death, head injury, most common, rupture abdominal organ, second most common. Differential diagnosis, acute abdominal will occur in intrinsic gastrointestinal disease, peritonitis, obstruction, inflammatory bowel disease, Merkel's diverticulum. Radiograph, stool test, intrinsic urinary tract disease, infection, stone culture, ultrasound, intravenous pyelogram, genital problems, torsion of the spermatic or ovarian system, history, physical examination, ultrasound, radiography, laparoscopy, sickle cell crisis, angiography, sickle cell studies. Bruising will occur in hemophilia, prothrombin time, partial thromboplastin time, von Willebrand disease, Henoch purpura, typical distribution of lesion, purpural fulminance, ruling out sepsis. Ehlers-Danlos syndrome, hyperextensibility, Mongolian spot, and not a true bruise. Fracture will occur in osteogenesis imperfecta, radiology and blue square or rickets, nutrition history, birth trauma, birth history, hypophosphatemia, decreased alkaline phosphatase, leukemia, complete blood count, bone marrow, neuroblastoma, bone marrow biopsy, osteomyelitis of septic arthritis history, local erythema or bulla, will occur in bacterial cellulitis, Pyoderma, gangrenosum, Staphylococcus symbiotico, culture and gram stain, herpes zoster simplex, scraping culture, epidermolysis bullosa, skin biopsy, contact dermatitis, allergic or irritant clinical characteristics, metaphyseal lesion, epiphyseal lesion, both are seen as scurvy. Nutritional history, Menkes disease, decreased copper, decreased ceruloplasmin, syphilis, little legal elbow. History, birth trauma history, physiological striae, linear red to purple mark may occur in teenagers due to sudden growth spurt. Investigation, family history record any previous infant death in similar circumstances. A similar previous death strongly goes in favor of child abuse. Thank you.